To ensure sustainable and impactful ways of rendering quality and dignifying care services to older persons within communities, the National Senior Citizen Center has made history in Nigeria with the unveiling of productive opportunities in the geriatric social care sector and centers in Nigeria. Clayview News correspondent was there and now tells us more. According to statistics, Nigeria's population amounts to about 206 million people. Despite lack of adequate data on older persons, Nigeria is not spared from the alarming figures, with about 14.8 million aged 40 years and above in 2020. With the theme Geriatric Social Care and Value Change, while inaugurating the first batch of training providers in Nigeria, the special advisor to the President on Health, Salma Ibrahim, said no older persons should be left behind in the initiative. Similarly, the Director General of the National Senior Citizen Center, Ememo Mokere, said Nscc is creating a system that will reach out to older persons across Nigeria.
So home-based care is another approach that we are also promoting to ensure that our elderly people continue to get access to care services so that they can be physically sound, mentally sound, but also to be able to contribute to national development. All the investments we are putting in care of senior citizens, it has to continue from where we are and do more from now, so that we have that seamless transition from generation to generation.
We also recognize that the care of older persons is competence-based, it's not for all comers. And therefore, the need for training, the need for skills assessment at both the training center and workplace. And also that interventions are based on assessments and through understanding of needs and context of older persons, and that investments in processes and systems to cater for the needs of older persons are indeed strategic opportunities. So investing in care for older persons can never be a loss to Nigeria. In fact, the disadvantage and the loss is where you don't invest.
Stakeholders, in their goodwill messages, while applauding the Director General of National Senior Citizen Center, Ememo Mokere, for the initiative, prayed for the sustainability and continuity of the project.
Geriatric social care involves all forms of practical assistance and support given to older persons in all care settings. These care settings could be at home, in the daycare centers, senior centers, respite homes, and long-term care facilities. Why do we need this type of care? We need it in order to promote healthy aging, aging with dignity, better quality of life, and independence for our older persons. That is why we need it.
It is important to note that the health and social care challenges of loneliness and lack of skilled care attendants to meet the long-term care needs of older persons is very critical. Hence, attention for care of older persons should be shifted from medical care to social care.
And we hope this guidance will contribute to making a difference for older persons in Nigeria in accessing good quality and longer-term social care. I think we heard earlier, in many countries across the globe, in addition to the physical and financial barriers that older persons encounter, they often also suffer from care being delayed or even denied.
And a lot of times when we get complaints from citizens, we only get complaints that has to do with whether women or children, boys, girls, and men. And we rarely get complaints about abuse of senior citizens. I know that the past year, through the National Senior Citizens Center, we've intervened on issues of elder abuse.
The Federal Ministry of Health and Social Welfare is committed to the health care for the aged through the provision of clinical care, training, and research and health sector support.
Medical experts say the geriatric social care workers will help the older persons attain social life, provide kind presence, and combat loneliness.
Changing the prospects for seniors by empowering those who would care for them with the necessary insights, mindsets, and skills to deliver the best possible value to the seniors' lives. Changing the experience of the seniors themselves from bland and even dispiriting to eager, joyful enthusiasm about the rest of their lives.
So it's no longer going to be business as usual, and I'm sure that given the kind of support we have had from the Chief Medical Director of UBT, Professor Darlington Obaseki, and the management of our hospital, other training facilities will do well if they have the kind of support that they need to raise a new crop of social sector professionals who will maintain the highest level of professionalism in providing care to older persons across different settings.
The two-day conference featured the launch of national benchmark and minimum standards for assessment of geriatric social care settings, among other things. Imefon Okon reporting for Clever News.